It's my pleasure this morning to welcome with us Dr. Gary Matzke. Dr. Matzke, in the series I'm calling Reflections for Pharmacy Leaders Advancing the Profession. Dr. Matzke is Professor Emeritus at the Virginia Commonwealth University, and he's also the founding director of the AACP, ASHP, VCU Congressional Healthcare Policy Fellowship Program. Dr. Matzke is known as a leader in nephrology, and he's also one of the co-editors of the pharmacotherapy textbook. So I welcome Dr. Matzke.
Hey, Terry. Good morning.
Good morning. Okay, we'll start off with, we'd like to learn more about your journey in your career and recognition as a leader in your area. And in response to that question, you may wish to include key events or persons who have influenced you in your journey.
Very good. Thank you for that opportunity. My career in pharmacy, again, is a typical aspect. Graduated from the University of Wisconsin and went into practice. And very shortly after being in practice, I realized that I had much to learn. And so I went back to the University of Minnesota and got my PharmD degree there. And while I was a PharmD student, I caught that research bug and actually completed 3 clinical trials during my PharmD clinical rotations. And that really kind of set the tone. And one of my last rotations was with a nephrology pharmacist at the County Medical Center, and that started me on that bent. So my first academic position was at Wayne State University, and in an environment in that time that was not exactly very progressive. It was a community hospital, a large one, and I brought with me the background from the Darwin Zaske and Ron Sawchuk experience in clinical pharmacokinetics, and I decided that I really believed that this was a way to improve patient health. And so set out to develop relationships with the medical staff there in Detroit and with the microbiology group. And in the year before I got there, they had done 7 gentamicin assays, 7 in a 1,000-bed institution. And they were not very receptive to my saying, well, we need to do many more than that so we can individualize therapy. And so I took the bull by the horns at that point, met up with folks in nuclear medicine rather than microbiology, and they said, yeah, you can use our lab. You can measure those samples yourself. You want to go draw them yourself. And so that starts that leadership aspect, if you will, of willing to step forward in situations that weren't entirely receptive, but what you really believe in is going to improve health. You do it because that's the right thing to do. And so I was able to complete a trial there of about 350 patients over the 1.5 to 2 years. And that was one of the first preeminent publications in the process. And the research bug with direct application of patient care became that mode of operandi going forward. So the leadership pathway and the development pathway continued. I went back to the University of Minnesota in '81, and during that time, transitioned from assistant director for clinical services in the pharmacy department to making it at that point a move over to the Department of Medicine. And so I developed sound relationships with folks in nephrology, and they welcomed me in, and with the caveat that I said, well, if you like what you see, then you pay me. If you don't, I'll pay myself, and then we'll a year later go down the road. But I think, again, that's that aspect of believing that you have something of value, and with metrics that those who are stepping the plate on your behalf can assess whether they really are receiving the value that you propose. And so over those 10 years at the University of Minnesota, began a team approach of aspect there. I was clinical faculty at the university and basically full-time in the Department of Medicine. And we built a program there, clinical pharmacology. We had, by the time we got to the end of the decade, we had 10 clinical pharmacists working within the Department of Medicine. We had them working in infectious disease, geriatrics, GI, transplant surgery, endocrine, as well as nephrology. And did lots of teaching for the curriculum for at the U, and thoroughly enjoyed the aspects that we did there. During that time, I was my first leadership role with national organizations, with ASHP, in terms of kinetic involvement, and then with ACCP, becoming a board member in 1987. So I left the University of Minnesota, went to the University of North Carolina, and during that time, really transitioned my research program from the stance of understanding what nephrology in the kidney did in terms of drug elimination, but look at what did kidney disease have as an impact on metabolism of medications. And we began to develop some techniques to be able to quantify hepatic function in ways that weren't necessarily utilized at that point in time. And again, it's an aspect that you believe in what you're doing. And we ended up having to create our own probes to do this. I found a contract lab at the University of Tennessee School of Pharmacy. They made the drug for us so that we could use as one of our components. And so you move along in not everything that you do is successful, but you plot the course of what you're attempting to do, and having to be fairly reasonably active in convincing others that there's value in what you're doing. From the University of Minnesota, I went to the University of Pittsburgh in '91, was there for 14 years, and that's largely where I've met lots of colleagues, both at Pitt and Duquesne and other schools in the region down in West Virginia. And my career focus there moved to training others in the field of nephrology. We developed a preceptorship program that trained hundreds of pharmacists in how to take care of patients in dialysis settings and in pre-dialysis clinics, and continue to develop our means to become measurers of quantification of hepatic function across the perspective, and that's where the Pittsburgh cocktail work came into being. During that time, it was began to be further involved in national organization. That was tended to be my focus, was dealing at the national level, and during those years a lot was involved with National Kidney Foundation, American Society of Nephrology, and in a bit battling the windmills, because there were no pharmacists at those times in those organizations. And meeting with leadership of physicians and nephrologists there to say, well, we as clinical pharmacists really have something that we can add, and we'd like to be part and partner with you. And over the years, those things came along and became very productive. Then in 2002, 2003, decided that I wanted to make a bit of a change from clinical research aspects to healthcare policy, and moved to a position with the American Association of Colleges of Pharmacy, and with a health policy fellow in the United States Senate for 18 months. And thankfully, the folks at Pitt were very supportive of that, and opened those avenues and doors. And when that finished in 2005, I moved to Virginia Commonwealth University, and over the last 15, 17 years, was elected the president of ACCP, was elected to the board of directors of AACP, and to the board of the American College of Clinical Pharmacology. So sometimes being in a mode of somewhat visibility by what you do, creativity to a degree, but I think most importantly, a willingness to serve, a willingness to step outside of the box that would say, well, that's all you have to do, is what led to many of those changes. And after having had the experience in Capitol Hill myself, I felt that just invaluable to get other pharmacists, and particularly young pharmacists, to be able to experience what is happening rather than sit back and say, well, it happened to me. You can participate in it happening for you. And now into 2020, we're 15 years into that program and have folks who have completed it. Some still serving at Capitol Hill, most moving on to use those skill sets either in academic settings or in business settings, and becoming an additional voice for the pharmacy profession. So that's kind of that leadership track of leading myself along.
Very good. Thank you. I'm going to pause here for a second. I have some background noise that is like shuffling. It's not paper, it's like something. I don't know if it's at my end or whatever, but I'm not doing anything here, so probably there's nothing. It could just be, I don't hear it now. It's only when I'm recording. Go ahead and talk. Let me see if I hear it.
Okay. Yeah, see if you pick anything up.
Yeah, when you talk, there's some kind of, it's not terribly obnoxious, but there's something. Let's keep talking. I'm
okay.
paused. Go ahead. Go ahead, keep talking.
Is there anything better in this realm than what you pick up?
No, there's something we're picking up. I don't know what it is. I don't want to say it's a cricket. I guess, I don't know what it is. Okay, I don't know what to say. We'll continue. I just paused it. I'll just resume. We'll go on to the next question. Weird. I don't know what it is. It's only when you don't hear it at your end when I talk.
No.
Okay.
No, I don't hear anything at all.
I hear it when you're talking. Okay, so I don't know. Let me, weird. Okay, thank you very much. Now the next question has to do with what do you believe will be your legacy in 20 years? And I paraphrase that question because sometimes people say legacy, but what are you most proud of in terms of your contributions that has helped advance the profession?
That's a great question, and I think it's really twofold, well, maybe threefold. I would say that the clinical pharmacokinetics and the thereby clinical research into documenting the effect of kidney disease, dialysis on drug disposition has been a major contribution. People throughout the world have used the research to enhance their care of patients, and that's really a key aspect of what one does. The second aspect is having been able to serve as an editor on pharmacotherapy, a pathophysiologic approach for 10 editions now, over 20 plus years, and that moves the aspect of patient care to those who are students, those who are developing on their own, and to improve how they care for patients. And that's been a major, I think, contribution that we look back at over time, and I look back with great pride of having been able to be involved with a group of editors and hundreds of authors who've done that well. And the last thing I would say is the Congressional Fellow Program, which at this point in time is unique. I would hope that it fosters others to develop like-minded programs, or at least other organizations in the pharmacy realm to get on board to make this resource available to other pharmacists and thereby advance the contributions that we can make. So I think those are kind of the three parts of the legacy that I think will continue on. They certainly seem to be, and I'm proud of them.
Very good, thank you. So the next question has to do with advice for students in their professional journey, especially how they develop as a leader.
Well, that's a very good question that I think to a degree you say changes with time and how we approach things. But I would say first and foremost, it's collaboration. It's realizing that in our care of patients or in our development of new knowledge and characterization of drugs and policy aspects, that we really need to be able to reach out to others and make that happen around us, and be willing to do that rather than think that it's my program or only the way that I can do things. I think second with that is to learn from others. I mean, to have a willingness to see through their eyes situations that if you only had your professional focus or your personal focus on, you wouldn't necessarily see. And lastly, to build from your strengths. I tended to see it in junior faculty and somewhat in colleagues that opportunities come up, they present themselves, but that's not really what I do, or I don't really do that well, or I've never done that, but now someone wants me to do that. And so they go off in left field from where they were focused for their life. And as a result, they may lose their focus, lose the passion that they had. And so stay the course, collaborate, learn, and you will be on the road to being able to have a fruitful life, and professionally and probably personally as well.
Very good. Thank you. Now, this is a history course that we'll be viewing these videos throughout. And one of the things as we study the decade of the 2020s, one of the key events in that decade will be the COVID-19 pandemic. And like other events in history that have shaped our profession, how do you see COVID-19 pandemic shaping our profession, in particular opportunities for our profession?
Again, an excellent question, Terry. I think at this point, we're 3 months or so into the active portion of this pandemic. I think that the profession of pharmacy will be most well served if we come through this time and go forward from it by focusing on the strengths that we have again. And by that, I mean, we can get diluted with the situation of, well, you can come into our pharmacy and we can do testing to see if you have COVID. You can come into our pharmacy and we can do antibodies. But is that really part of the core of who we are as pharmacists and what we add life? And I'm not sure that we do. There's lots of folks who do some of those things. The management of patients' medication therapy, being able to look at lifelong influences, whether they're diabetes management, whether they're weight control issues, whether they're aspects of managing high blood pressure. Those things go on and on and on day after day. We look at this pandemic as a point in time that may change how we do some of those things. But if we lose sight of what we do to do what someone else can do, or we contribute, we may, in the long run, not be serving ourselves best, nor the patients that look to us for care, because then we become a little bit losing our strength, losing our uniqueness that we have to add to others on the healthcare team. So using technology, learning to better be able to reach folks where they are. Could we be using this technology that brings us into people's homes to be able to address the issue of how do you store your medication? Well, that's not a big deal. Well, you may find an aspect that Mrs. Jones feels that she is short on her medication because her stockpile has gone down. I was talking with an individual just this past week, and they were saying, well, I'm not getting my meds from my pharmacy like I should. And we went into the home, and she had a 180-day supply of her pain medication, but she didn't think that was enough. But I couldn't see that until I was there. And so there are aspects that we can move past that question at a pharmacy counter or in the consultation booth, and that this pandemic may stimulate us to look to further ways to enhance our understanding of the patients we care for and do a better job.
Thank you very much. Thank you again, Dr. Matzke. It's been a pleasure.